Welcome to tonight's webinar, Creating Natural Aesthetics with Next Generation Nano Composites, a simplified approach to rebuilding teeth using minimally invasive concepts. My name is Frank Milner. I'm a dentist in St. Paul, Minnesota. I want to welcome everybody from, whether you're from the United States, international, all over the world. What unites us is continuing education, and this is very valuable and an honor for me to be in front of you again. This is my 11th webinar with Viva Learning. So my goal is to give you take-home messages, things you can learn tonight with a fair and balanced approach. I'll try to mention some other products as well as the sponsors' products tonight. Again, we have people from all over the world, so let's get started, and I'll point you in the direction of the webinar. Our objectives tonight is a logical, sequential step-by-step approach when restoring complex or simple anterior restorations, finishing and polishing, and learn about a new nanotechnology composite system that simplifies bonding. Everything is getting more simple in terms of our technology today. But can we understand it? Can we use it to its fullest advantages? I'm going to try to give you some tips tonight and cue you in on how you can incorporate simplified techniques and layering in your anterior composites. I want to thank Colteen, the sponsor for tonight. I want to really say that Colteen is ramping up in the CE department and bringing education to you. The products are great, as other manufacturers' products are too. And I want to thank Viva Learning, a very, very good host for online learning in the dental profession. For those of you who don't know me, I consider myself a teacher. I don't think I'm an instructor or a lecturer. I'm a teacher. I like to teach. I like to transfer my knowledge and what I've learned in 40+ years of dentistry, so you can learn from me to its fullest extent. For the Sunshine Act, for disclosure, these are some of the companies I've worked with and lectured for in the past. I received no royalties from them. However, for disclosure tonight, I have received an honorarium from Colteen. I have received permission to educate you and not to sell you on products, but how to learn how to use Colteen's products as well as others, and really enjoy your dentistry a lot more. More disclosure. In my presentation, I'm proud to say that I have not altered any of the photographs except for contrast, brightness, and gamma. This is my pride as a lecturer and presenting you important information. Somebody I hold dear to my heart was Jeff Golub Evans, dentist in New York, who is an artist. He said, Frank, you're either a whittler or a paster. If you are a whittler, you're Michelangelo trying to find the statue of David within the marble. And if you are a paster, what you are is Rodin's thinker. You are logically and sequentially putting things together, hand to the forearm, arm to the torso, so on and so forth. I really want you to be pasters, and I don't think we're as good as Michelangelo, but you'll see my work. I'm more like Rodin's the thinker. Let's talk about what we're going to be doing tonight. We're going to do the heavy lifting first. This is the foundational information about product development. You'll see maybe 2 clinical cases. We'll do some reviewing. And how do we choose the correct composite system? Well, before we look to the future, let's look to the past. In the 70s, I graduated in 1976. Composites were emerging to replace acrylic resin, but the particles were very large, adaptic, concise, P10, Scotch bond adhesive, megapascals of 2 to 3, wasn't too adhesive back then, And these early composites resulted in difficult polishing and surface roughness as the large particles were plucked from the resin's matrix, which left a pothole on the surface, and they became very dull very quickly. To combat these unwanted properties, the first microfill composites were developed in the 80s, and they're still out there today. Although a class of the composites, the microfills, polished well, chipping and bulk fracture limited their use to high-stress bearing areas, and that still stands today. In the 1990s, the particle sizes were getting smaller, and then there was a synergy of composite bonding technology to advance the composite use. There was a greater understanding of the importance of particles in the resin matrix, and the particle content was manipulated in terms of particle shape, load, size, chemical makeup. Everything was getting smaller. Currently, as a result of the development of the nanotechnology that we are very familiar with, we find ourselves surrounded by many materials with excellent handling capabilities, great durability, enhanced bonding capabilities, less shrinkage, improved polishing, and highly aesthetic optical effects. However, all that being said, the most important factor in the clinician's knowledge of the nuances of these new materials they are working with is, can they master to satisfy the aesthetic objectives? In other words, how do you use these? That's our goal tonight. Well, as Van Gogh said, great things are not done by impulse, but by a small series of things brought together, right from the prep to the adhesion, restabilization of the oral environment, saliva pH, biofilm, things like that, curing lights. It all is a series of things. What I know about you and what I know about myself is, what do I like? And if I query you on anterior and posterior clinical needs, is anterior and posterior the most important component is handling. How does it handle? Is it sticky? And if you look at the criteria from anterior and posterior as we drop down, polishability does vary the anterior to the posterior. Anterior being more popular, posterior polishability does drop down. But all these components of composites today are essential, and we'll break them down for you. What do the patients want? They want things that look good, and they want things that don't fall off, and they don't create sensitivity issues. What do you want as a clinician? You can see the criteria here: long-lasting, great handling, simple technique, good physical properties, good color matching. What's changed? Nanotechnology has raised the bar with these dwarf little particles that actually become chameleons and inherit the color of the environment. And the layering techniques that myself and a lot of my colleagues have taught in complex workshops, 24, 26 shades, we still teach them. Not as much, but we're teaching simplicity now, very simplistic designs and layering concepts with easy to understand finishing and polishing. What do the dentists want most for the anterior and posterior in their composite systems that they use today? Number one, preferred handling. And I can watch you in my workshops, and I can tell you what kind of work is going to be there on the surface by how you handle the material. Coating. What has coating done? Coating has done the same thing as a lot of manufacturers. They've created universal materials. They've created universal bonding agents. What they've created is a new launch coming in right now to the marketplace called Brilliant Everglow, which is it's not a stiff material, it's not a runny material, it's kind of a very unique optimum handling and it has a good color reproduction, but like with the new materials in the marketplace, there's a high polishability to this, and it's a very simple technique with strong physical properties. And I'll try to mention some more materials as well as far as we proceed. What have the people who have commented on the use of this, they say it's very easy to use, as well as other manufacturers. There's very good products out there. No hassle, gets to a high luster very quickly, and you don't have to labor to get the hand polish or the luster on the surface. I mean, there's some really good ones out there. Admira Fuchsia from Boko, Beautiful 2 from Shofu, Tokiyama's Estelite Sigma, all high-end materials. I do know about what your needs and wants are and what your capabilities are. Is our profession at large, well, maybe a little under 70% use one shade. And there's nothing wrong with that. That's how you do your aesthetics, your Achilles heel. Maybe 17% of our dentists at large can use opaque shades, and maybe 16% can use a translucent shade. So we have to simplify the palette as we go on. One of the quotes I have is reverse engineering. And for those who have taken my lectures or been in my classes, I see things from the inside out. I don't see it from the top down. It's bottom-up dentistry, starting with the adhesion, starting with that first restorative layer that creates the tooth restorative interface that prevents sensitivity, that prevents the shrinkage, so on and so forth. In other words, we see it from the inside out. Those of you who know me understand that I'm a very creative, artistic person. And what we have to do is start out with color. And I'm going to start out by just telling you, in the world we live in, there's 13 million different color variants in the international standards of color. What you see in the tooth space right up here in the red-yellow quadrant in this little elliptical square here, or sphere here, is the human colors. And in that sphere right there, there's 1,000 different human colors that are possible, of which we can see as human beings 100 variations of that. So that's 100 out of 1,000. That's basically a 10% chance to match color. I'm going to talk about the Vita Classic Shade Guide. Everybody has seen it. I'm sure some still use it. Some have evolved from it. And the Vita Classic Shade Guide, if you transpose it into the human tooth space, you can see that some of these colors actually reside outside the tooth sphere, and the rest of them look like little NASCARs all jammed up or far away. They don't really exemplify a equidistant color matching potential. What do I mean? If you look at the color sphere of the human teeth, and let's look at the A range. The A range are systematic and actually ordered pretty well inside the tooth sphere. And that's why 80% of the dentins are in the A range, 10% in the B range. As we move from the A to the B, we're starting to scatter now, and the B1 is actually outside the sphere. The B2, 3, and 4 are almost in the sphere, but not as a popular shade. The problem is when we start getting into the C's, they're outside the tooth sphere. These are manufactured shades that were developed by V-Dent prosthetically by demand for the dentist for this kind of color. A lot of these are European shades. And then we get into the D's, and again, the D's are not in the sphere, so to speak. They're very artificial manufactured shades. Let's talk about the dimensions of color before we go into the materials itself. Is that the first thing is hue. This is the color of an object: blue, red, green, yellow, beta A, B, C, D, that's hue. Chroma is the saturation of hue, light yellow versus dark yellow. Hue is A, chroma is 1, A1, that's light saturation. A4, hue is A, saturation high, 4. Value is the brightness of an object. This is what you see with the rods of the eyes. It's relative. The darkness or lightness, everything else is a shade of gray in the middle. Again, if in review, if we look at all these 6 components of shade transfer, and we categorize the most important one of hue, chroma, value, surface texture, form, translucency, value is our driver. If we get the right value, and this correlates to the enamel shades, then we can get aesthetic matching that satisfies the criteria of natural aesthetics. Translucency is the final third. Form is important with finishers, polishers. Surface texture is an art of realism that I can teach in advanced classes or you learn from your ceramists. Chroma is the highly saturated component in the cervical third, where there's a lot of dentin influence, and hue is in the center third of the tooth, where there's 30% dentin influence. Let's pick on the Vita Classic some more before we move on. There's 16 colors, and they're split into 4 hue groups, A, B, C, and D. And what you see, their limitations, they're light, they're dark, they're dark, they're light, they're all over the board. And there's no in-between shades because they're not arranged logically and sequentially. These came from Germany in the denture factories of the early 1900s, and they were used for denture prosthetics only, and they parachuted into our operatories. The limitations of these systems are their color gaps. There's no value-based. A1 means A is the hue, 1 is the chroma. There's no value determinant in the Vita Classic. You can't really use them for crown and bridge, so to speak, because they're not value-based. You probably want to move into a Vita 3D Master Shade Guide, and they're not systematic as well. Having some fun with the Vita Classic Shade Guide, I really changed things up a little bit, and I'll show you how I rearranged it. And there's 3 chromatic groups, one on the left side right here, and these are going to correlate into your high-value enamel shades overlaid. The second chromatic group is in the middle. These are 35 to 55-year-old people, and these have medium value enamel shades over the top. And then the third group is 55 and older. These are the mature people that you have a low value enamel over the top for natural aesthetics as well. Now, the limits of the Vita Classic is there's no relationship to value. And we all know the A's, the B's, the C's, and the D's. But really, as a smile designer and as an artist and an artisan, we see by value and we see from bright to dark by utilizing different thicknesses of enamel from the centrals, the laterals, and the canines. This is called the polychromicity of natural aesthetics. And indeed, this is an art that can be taught in high-level classes. I want you to think before you restore. The hands do what the eyes see. The brain sees it first, thinks about it, and then it translates into the commands of the hands, and they obey the eyes and the brain. I want you to think about what you're doing and what you're seeing before you start restoring. As Norman Rockwell would categorize this by drawing himself or drawing a tooth, it's aesthetic observation. I call this the gallery of natural teeth. When you go into your ophthalmologist or optometrist, they dilate your pupils and you start reading the chart and see how well you can see. Here's the problem. When we get into natural aesthetics and shade transfer, we get a little skewed and blurry on the bottom lines, but we're pretty darn good with an A2 and an A3, the popular reorders of all the Vita shades from all manufacturers. Let's look at this tooth. What is the language of this tooth right here? This is a monochromatic, semi-translucent monoblock in the gingival 2/3 with some translucency mamelons and halos. This is a somewhat complex tooth. And if you look at the value-based concept in the human tooth sphere right here, is that we want all these value shades to be equidistant so we can have intermediate shades like the Vita 3D master shades, and that's where Coltine's going to go and try to give you some leverage into value-based dentistry. These are some teeth that I hand sculpted free-handed. I think I know what they look like, and I think I know how the morphology is, and so I can extrapolate that into my work. Let's talk about the color language of the teeth before we start getting into the design. First of all, the gingival third has the most colors. This has the highly saturated chroma. There's dentin coming close to the surface, so if you like Vita shades, this is where you want to hang out. In the center of the tooth, this is the brightest. This has the highest value. This breaks it apart from the cervical third. And in the incisal 1/3, you have lower value because you have incisal translucency. The dentin core isn't there to stop light, and hence you have the language of the tooth. You look at the cross-section of the tooth, especially when we start thinking about incorporating enamel shades in the cervical third. One would put maybe 3/10 millimeters of enamel. In the body is 5/10. In the incisal, this is where the leverage comes from value determination, where you want to use these enamel shades, especially in the incisal third, to create the luminosity or the value. In the cervical third, it's the chromaticity, that's the dentin influence of it. How is color produced in the tooth? Color is produced within the dentin enamel junction by the dentin itself, which creates the hue and the chroma. At the DEJ, outside of that is the rigid glass connector called enamel, which modulates the value. This is how value is created with enamel shades. If we do a buildup on this, we see a class 4 and the cross section of it. What we do is stop dentin shades A1, A2, A3 at the DEJ. That's what it looks like. And then we can add some value effects on the dentin lobes itself. Then we can put a generic enamel shade, maybe 3/10 millimeters, 5/10 millimeters, to leverage the value and get the correct value for aesthetic shade match. Or we can put a clear finish on this, and that makes the difference so you see depth of color. You can't do that when you put a Vita A1, B1, 2, A3, all the way up to the surface. There is no value on that. Before you build in the mouth, what we really want to do is put these aesthetic swatches, little spheres of composites, dentin enamel, translucency, roll them up into little balls, light cure them. These are your color estimates instead of shade guides. That's how you build. Now, let's talk about our featured product, Brilliant Everglow. It's a universal submicron hybrid nano composite. Again, there's many good ones in the marketplace today. Many manufacturers make good ones, and now it's Coltine's turn into the nano business with a new launch. Let's talk about it. It's universal. You can use it for their comp and air luting. They have a dedicated direct composite veneer that's very popular. You can use it for repairing. You can use it as a universal composite anterior, posterior. Let's talk about some of the facets. It's a dual shade system. I gave you some tips on the Vita Classic. I'm going to really drill down into this now and tell you why you need less shades into this palette and why it makes sense for simplified decision making. And you're going to also buy less shades, so there's an economical benefit to this as well. What is the dual shade? If I take that Vita Classic shade guide now and I rearrange it, instead of light, dark, dark, light, light, dark, dark, light, I rearrange it into lightest to the darkest, highest theoretical value to lowest theoretical value. There is no value, it's all hue and chroma, but here's what it is. Here's how you do these things. If you rearrange that Vita Classic shade guide and you can use 3 determinate enamel shades, the higher value enamel shades are utilized on the higher hue chroma Denton shades up to age 35. 35 to 55, you're in the middle of the shade guide, and these are the medium value enamel shades if you put those on top of the 35 to 55-year-old population. And then the geriatric population is over 55 years in age, and then we're going to take a lower value enamel, lower value translucency shade to overlay, especially in the class 5s, and that's how you get depth of color. This is a rubric, and once you can break that and solve the rubric, you can match natural aesthetics. How do you do it with Colteen's product, the Brilliant Everglow? Well, the 2 shades that they have, there's 2 enamel shades, bleach translucent. I mean, just about every manufacturer has a high value translucent. This is their bleach translucent. It is a very good high value enamel shade. And then they have a translucent, not clear, has some pigment in it, and this is great for depth of color on class 5s and sizal translucency. What Colteen really wants to do, and what every manufacturer should be for the porcelains and composites, is cover the tooth sphere evenly, systematically, value-based. It allows for adjustments, and it's easy to understand. This is the direction of where our profession is going in the direct and indirect world. Let's talk about how do you build from the inside out. There are 7 possibilities of universal shades, inclusive of a bleach shade for younger people. And they have 6 possibilities of the universal dual shade in here. I'll break those down. And they have 2 enamel shades. Here's how it works. If you use opacers, if you're 17% of the dentists who can incorporate opacers, you're going to have 3 possibilities here. A lot of manufacturers have 3 or 4. I think you should really drill down and get 1 for sure, and we'll talk about that. The dual shade here, including the bleach shade, these are interlocked together according to the theoretical value where you are on that Vita Classic shade guide. And then you have 2 shades. This is a very simplified palette. It's very economical to use. Let's talk about it. Here's your bleach shade right here. Now we're going to start combining these and joining these together in high value A1B1, A2B2, A3D3, A35B3, C2C3, A4C4. These are class 5s. In this area, this could be a class 5. These are European. This is a class 5 shade. This is a geriatric shade. And then we start getting younger, 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 younger. So we have the bleach shade, the translucent shade, 3 opacers right here. Let's look closely now. I'm going to slow down. When do you use these? You're using these to stop the light. When you take and use one of these opacers, when you have a class 4, you have a diastema, you want to knock out a dark gingival box, you should layer this in about 5/10 millimeters thick, maybe a millimeter. Opaque bleach has no hue. It's very intense white. It absorbs a lot of light. It's like kills on the black wall. Opaque BA1 is my favorite. I think that's your safest bet. For any universal tooth, for a young tooth, you want to use this one. And an opaque A3, I don't use that too often, but nonetheless, it is still available. So how do you use these shades, this simplified palette? First, you select the Denton shade, The dual shade components, you want to find out through color swatching on the surface of the tooth, which ones of these do you pick first? Then stop, think. Are you incorporating enamel on the surface? If not, stay with the universal shades. If you want to create depth of color or more value-based, then you're either going to pick the bleach translucent for a younger tooth or a translucent maybe for a middle-age or older tooth for more depth of color or the incisal third. Where do you put them? On the incisal edge of adult teeth here for the translucent or the bleach translucent for younger teeth. I think we got it. Now, what makes this syringe very different from other syringes is what they did was put a glass sleeve on it, acrylic glass sleeve, and it's really kind of cool. It's easy to look at. It doesn't get all scratched up. It's easy to wipe off. I give them credit for coming up with a new design. I like it. It's a very nice syringe, and it comes in compules as well. So this is a nano composite. It's for anterior. It's for posterior, as other manufacturers. They are universal submicron nanotech composite systems. You can use them for single layer. You can use them for multi-layer. Depends on what you are doing and what your expectation is and what the patient's expectation or your reimbursement level. 2 steps on this simplified palette. Now, I'm going to say something else here. I'm trying to be fair, is that in the day, Vocal came up with Vocal Ameris. This also had a simplified palette, and it's not as popular today, but it's still a good system. Grandioso replaced that. But nonetheless, I did like the Vocal Ameris system. There's 7 shades first, and so for your universal shades, Denton, you can correct as you go. When you build it, you can say, hey, I'm almost at the top. Maybe I can just pick up another syringe or compule, put a little bleach translucent on the top or a little bit of translucency to get some depth of color on it. There's not much of a learning curve when we do these things, and I think this is the simplistic approach. There's no substitute for knowledge and learning correctly how to use these. As I said in the opening, you don't want to use them carelessly. And these are minimally light sensitive. Put the overhead light on the chin, take up to 15 minutes on the layer, and you'll be good investing in the build-up process versus the finishing and polishing process. What are we doing in review? The system that mimics tooth structure with just 2 categories. We have Denton, which goes to the DEJ, which gives the tooth its color, hue and chroma. And then we have enamel, which starts on top of the DEJ, which controls the luminosity or the value of the tooth and or the restoration. That way you mimic nature. Now, I'm not going to throw a lot of charts at you in comparison to other manufacturers, maybe a couple. These aren't my slides. Let's take a look at the comparative analysis of the previous generation of Coltine composites called Synergy D6. Very good system, dual shade, highly filled, physical properties very good, but I think where I want to go with this one in comparison to the Synergy D6, I really want you to take a look at some of the parameters of wear rate is better, compression strength, all in the same range. The polishing on this particular composite system puts it in the top categories with other top category manufacturers for gloss, creating the ease of creating gloss and the ability to maintain the gloss after the wear cycles on these. These are low shrinkage, but the other part here, as with other top tier composite systems, is that these are not sticky, they're very user friendly. if you look at the comparative analysis, not to say good or bad, I really want to cue you in on the brilliant Everglow in a comparative study with other manufacturers, either on a two-step finishing process and polishing process to a four-step finishing and polishing. You can see that the brilliant Everglow does stack up very well to other manufacturers. They had a field test and 77% of the clinicians liked it. I'm sure a lot of manufacturers can produce data like this too. Now, the filler technology, it's not sticky. It handles good. I said this in the beginning of the webinar tonight. What do dentists like? They want things that handle well, simple technique. They want polishability. This material has these features as well as the compressive strength. It stacks up very well to the upper tier manufacturers. It is a very good product. Let's go to the clinical cases now. What is your criteria when you emulate? Would this be your daughter? Would this be your wife? Would this be your best friend? When you take a look at a class 4, when we do these clinical cases, we start breaking down the teeth into replacement of class 4s. The initial observation is these are somewhat monochromatic blocks here, and especially if you look at the surface, these are fairly high, shiny surfaces with no surface characterization. However, you do have line angles that we're going to talk about, and we're going to take away this dull, lifeless composite with minimally invasive concepts and see if we can rejuvenate it and make them repairable for the future. So here we go. We look at the incisal shot here, and you can see why we're replacing. We got micro leakage. And we look at it the other way, we can see what we're doing with the form of the tooth. This is the aesthetic, or what I call the color estimates or aesthetic preview. I don't call it shade selection with my patients. Is I will put say an opaque shade up here. I might put 2 dentin shades here and see which one I select with my assistant Sharon. We're all in this color estimate together. And then I'll take 2 enamel shades here, roll them up in little spheres, put some striations in and light cure them, and then we'll select the building order of stratification, or how are we going to build these teeth from the inside out. Do a mock-up, make a putty stent. Colting has got a soft putty polyvinyl material that's very good, and then we're going to take these teeth apart. Carefully preserve all the enamel that you can, and you can see here we don't want any sharp enamel rods creating point stress, and then we want to incorporate beveling system on the facial. The bigger the fracture, the longer the bevel, and then do the proper adhesion, building the tooth from the inside out. Again, this is your hydroxyapatite. This is the best of the best. This is repairable now. These are the preps. Now, phosphoric acid, I am a selective etcher, so these teeth were first bathed with chlorhexidine as a disinfectant. They were total etched with phosphoric acid as per manufacturer's instructions. They were rinsed, they were dried. And then I would go into a 7th generation universal dentin bonding agent. In this case, Colting has now launched their One Coat 7 or OC 7 Universal. I use 7th generation bonding agents, and there are other good ones in the marketplace: Futura Bond Universal, Disco Universal, Beauty Bond, from Shofu. There's many more. I don't want to leave others out, but there are very many good universal bonding agents. Try the adhesive placed preps into the stent. Now I can start building. And in this case, I'd either take the opaque A1, a very thin taco shell to stop the light. so I don't see show through. And here you see a deliberate attempt to stop the light so I can maintain the value, because if the light goes through, then you're going to see the darkness of the oral cavity, and then the value goes down. You get gray looking restoration. So here we're just putting a very thin taco shell opaque layer and not fusing the midline. Keep it nice and clean. And then we'll put our universal A1B1 in. It's a high value, and I have instrumentation for this. We build them together in tandem because we're not closing the midline at this point. We're reflecting the light, and then I want to leave maybe 0.3 millimeters open for, on top of this, to modulate the value or the luminosity to get the right aesthetic match. Now, here you can see tooth number 8 has been built up to the DEJ. And then what I'll do with the stent in place, I'll put the bleach translucent layer on top of that one and make a full contoured restoration, maybe 5% overbuilt. And that's what that looks like. And then verify the midline. You can put matrices in, the BioClear matrix. You can use Mylar, not my favorite. At that point, dead soft, I like Teflon tape. This happens to be Toffelmeyer cannibalized, that I have a rigid matrice right here, and then I can put my enamel shades in as well as that. And these are the monoblocks that are built, and this is generically built right now, shy of finishing and polishing. I will do some minor modification before I light cure from the lingual and the buccal. And that way we have total cure, put deox on there for the oxygen inhibition layer. This is what my work looks like right after light curing. I have minimal cleanup time to do. Let's talk about what do we do. I'd start out with disking system, and Coltine has the Swiss Flex discs that are very good. There's no hub sticking out of the middle, and Shofu has them. Brasler's got a new disc too without the hub sticking out. I like these. I like the Alpen polishers and finishers. Shofu makes very good ones. I can't say enough about some of the manufacturers that offer a lot of good finishers and polishers. We'll go on in the sequencing. After the disking, I'll be taking a very high RPM, low torque silicone polisher. I do use greenstones, and then we can get into the brushing of such things. This happens to be a Groovy from Clinician's Choice, and now I'm going to mention some other manufacturers, is that Brasler makes them, Ultradent makes these. Coltine has come up with their new ShapeGuard polishers, which is a brand new upgrade in generation of finishers and polishers. They have silicon carbide on them. That's the direction that we're going. And with the final luster, I don't want to spend a lot of time on finishing and polishing. In the construction business that I have 8 years of experience in undergrad and dental school, is you can't have a good finish without a good prep. And you have to have the good prep before you can finish and polish. And this is how we can mirror aesthetics today. Your work can probably look as good as mine or better. This has taken 40 years to get to this point to mimic nature. And this is something that I take pride in. Let's go over a diastema case, same simplistic protocols, is that we have monoblocks right now. These are not aesthetically complex teeth. These are basically Vita dreams. These could be A1, B1, maybe some enamel over the top. We're going to do a study model, do a mock-up, make a stent. This is what the wax up looks like. This is what the stent looks like to verify the midline. Basically, I'll either take a Alpen burr here and minimally invasive, just rough up the enamel. The literature and evidence base supports this. I'll take Composites, I'll phosphoric acid these teeth in their entire surfaces. I haven't destroyed any tooth structure. I've disengaged the hydroxyapatite in the enamel rods. After that, we would take the OC7 universal bond or the bonding agent of your choice and very carefully place one layer of dentin bonding adhesive with no blobs or irregularities that would create overhang and flash. This is what adhesion looks like. All the total surface is adhered. And then you can see I'm putting in the A1, B1 on one side, almost a full contour. Then I'll do the A1, B1 on the other side, almost a full contour. At this point, I'll take my caliper and measure the slots so I know when I put a little bit of enamel over the top, I have symmetry from left to right, 8 central, right central to the left central. These are freehand bonded with no matrix. I want you to use a matrix. I want you to do one entire tooth, get it finished, verify the midline, make sure there's no overhangs, and then do the other one with a proper BioClear matrix or dead soft Tafelmeyer of your choice. And then take your calipers and measure that. And then we go to finishing and polishing. Now we can go to 30 fluted carbides. Elpin makes these, Shofu makes these, Brasler makes these. A lot of manufacturers make these, and 30 fluted carbides are good. 16 fluted, 8 fluted, whatever you want. And then you can get into your polishing cups. And then Coltine does make these as well. These are either the brushes or the points. Again, you can get the Groovies from Clinician's Choice. They have Kevlar in it. Brasler, Ultradent makes these. They're very good. And then we do a little detailing, a little high luster finessing into these restorations. You can put polishing paste with a goat hair wheel from Ultradent, a dry goat hair wheel here. Try it in the stent. This is the before, and this is the after. Now, this is my trade. This is what I know how to do, and I know how to mimic nature. So we can go from this to that to have minimally invasive, reversible, adhesive, repairable dentistry. This is your future, especially you young dentists. You don't want to do rapid destruction. Veneer these things out, incorporate them into a laboratory box or take a scanner, send them to a laboratory and put a porcelain laminate on, not needed. Do free-handed dentistry. This is life at its best. You're putting that tooth in the tooth bank and saving it for a generation of materials that don't even exist today. This is my passion to bring it to you. Now, we're coming down to the last 10 minutes of this webinar. What's my point? Pablo Picasso said it right. The meaning of life is to find your gift. The purpose of life is to give it away. At 40 plus years of doing dentistry, I realized the gift that has been given to me by those that were more talented than I was, those that were more patient than I was, to mentor me, to steer me down the right path of education and giving back to a profession that's been very, very good to me, and interfacing me with manufacturers that care about dental education. Coltine, so many manufacturers that care about bringing excellence to our profession. And our responsibility now as tenured clinicians is to find those young dentists, those young graduates that are online, that are not in study groups, and mentor them so they can understand what the mantle of dentistry is, and they can protect it like we protect it as well.